Resistance to HER2-targeted therapies is an interesting question because we're not quite sure whether the resistance is truly to HER2 or it is to the underlying partner for the anti-HER2 agent. There are strategies that people are employing. In other words, some people feel it may be a result of, say, issues with the receptor tyrosine kinase, so therefore oral agents may work, such as lapatinib, neratinib, other drugs, poziotinib, ONT-380. It's tucaropanib, I think I can never pronounce it right. These drugs may help. There are other things that we've tried. We've tried looking at the mTOR pathway. The Bolero-3 trial really didn't work that well. It had modest benefit where we added everolimus to vinorelbine and trastuzumab. Didn't work that well. But in other words, that was a strategy that people used. I think that the latest possibility may be in the CDK4/6 pathway. There's a lot of trials out there now of trastuzumab plus various CDK4/6 inhibitors, abemaciclib, etc. So we'll see what happens. There are also, actually, interestingly enough, trials not only with pertuzumab, which is kind of one area that doesn't really overcome resistance, but actually probably amplifies the anti-HER2 effect. But there are other anti-HER3 agents that are out there now that are in trials. It's not so much the resistance, I think, that we're worried about in HER2. It's the fact that a lot of the agents we have don't penetrate the CNS. I think that's what's happening now in HER2-positive disease, especially metastatic disease, is the same thing that happened in pediatric leukemias 40 years ago. And that is that we got very good at treating the systemic disease, but they're sanctuary sites, and in this case, the brain. And I think that most of my colleagues would likely agree that about 50% of patients with HER2-positive metastatic breast cancer will eventually develop brain metastases at some point, because we now keep them out 4, 5, 6 years without systemic progression. And I think that's probably going to be the major cause of death in these women. And I think that it's incumbent on all of us to figure out what to do. And I think some of these small molecule HER2 tyrosine kinase may be the beginning of the pathway forward. But so it's not so much resistance as it is sanctuary sites in HER2 right now.